Welcome to Learn at Work, a webinar series presented by the journal Work, a journal of prevention, assessment, and rehabilitation. In 2018, we are presenting all of our webinars in cooperation with the Human Factors and Ergonomics Society. I do want to extend my gratitude to the publisher of Work, iOS Press, for sponsoring these monthly webinars. I'm Karen Jacobs, the founding editor of Work, and I'll be your moderator today. We have a very exciting presentation next. Linda Miller, I'm going to turn this over to you, and please introduce yourself and your co-presenter.
Thank you, Karen. My name is Dr. Linda Miller, and I'm going to be co-presenting today with Catherine Ritchie. We're actually out of Edmonton, Alberta, Canada, and we're both registered or certified professional ergonomists. And I currently own and operate a company, EWI Works out of Canada. So I just thought I'd project up a couple of pictures of us so you know who's going to be talking to you today. And we currently actually specialize in occupational ergonomics, and we've spent the last couple of years really focusing on how we can get more technology in the delivery of ergonomic services, as well as education as well. So we're going to start into the presentation. So today we're going to be covering just a brief overview around what is telehealth and how it's used currently in other parts of healthcare. Then we're going to move into the case study, and that's when I'm going to turn it over to Catherine Ritchie. And then we're going to discuss some of the lessons learned from our case study and how we're moving forward with telehealth and delivery of office ergonomic assessments. So just to briefly introduce what telehealth is, and we have pulled, prior to actually starting this project, two definitions, and since we're out of Canada, we pulled them from Health Canada and then Health ID, IT, which is another government organization. And what's interesting about the definition for telehealth, it's really looking at information and communication technologies. And those technologies are used to support, educate, and inform and connect healthcare professionals and the people they serve. So it's really the bridging between the healthcare professionals and the individuals that are seeking out those services. So when we first started looking at the option of using telehealth, we wanted to ask the question, was there an opportunity in the area of ergonomics? And so we went into some of the literature that's out there, and we thought, you know, telehealth is really innovative. It's a way for us to look at how we can use information, how we can use telecommunication technologies to actually overcome some of the distances that people have in terms of barriers between themselves and the healthcare environments, or for us, actually access to qualified ergonomists or people that have been trained in the field of ergonomics. We also saw it was a tremendous opportunity to reduce travel that would be related to healthcare providers that would have to go up to remote communities, or even clients that would have to come into some of the bigger centers where we had specialized trained individuals associated with healthcare, but also in our area around ergonomics. The other piece of it that became very evident as we started looking at telehealth is the associated travel costs and the reduction in travel costs, which can be potentially prohibitive when delivering healthcare in a setting for people that have to travel long distances. So there's quite a few opportunities to use telehealth overall. So when we went into the literature, it was quite evident that there are a number of groups that are currently using telehealth and telecommunications very successfully. If you go into some of the addictions and mental health, you certainly see lots of counseling being delivered online using telecommunication technologies. I even had the opportunity to look at some of the heart and stroke rehabilitation, and they're using it to actually even link clients together so that they can participate in group rehabilitation sessions. But again, it's all being done through telecommunication technologies. We also see it for the support of individuals with chronic diseases, so they can be monitored and tracked and have good intervention from highly skilled healthcare professionals. And certainly we see it in the area of seniors health, and certainly in our area, and I'm an occupational therapist as well, and we see it being implemented in a number of rehabilitation services. I actually had the recent opportunity to talk to a senior researcher here out of Edmonton. She was actually with speech and language pathology, and she had looked at the use of telecommunication technologies with children with cerebral palsy and autism. And she said, really, there's very little difference now between the in-person delivery of rehabilitation services and the telecommunications. So it's a really exciting opportunity that we can bridge where there is a gap in terms of people being outside of major centers, and it gives them the opportunity to participate. So one of the questions we asked, and as we were going through the literature to try and start to build this whole approach to telehealth and ergonomics, is we haven't really seen it a lot in the literature or even had it described very often out into the general community. The studies that Catherine's actually going to go over is actually related to Dr. Jacobs. So thank you, Karen, for those studies. They helped guide us when we were starting to look at the approach of how we potentially could deliver ergonomic education. But more importantly for us, we really wanted to see if we could use it for assessments. So it was certainly looking at that opportunity. Why we felt that it was important for us to start exploring how we could actually implement remote ergonomics is that we live in actually northern Canada, and for a lot of the communities that we have to access, there's fairly great distances. So there's lots of travel that's associated with it. And for us, we often feel like we're spending the majority of our time in winter conditions. And so it's often that we're going to be exposed to poor road conditions that could affect if we're going to even make it out to those remote communities. And that could actually delay delivery of service or delivery of the assessments. And potentially, if people aren't getting a timely assessment, it can impact their overall potential risk for long-term injury. And so we see this as a huge benefit that we could improve accessibility. The other part about it is certainly around costs. And there is significant cost savings as you go farther outside of the major centers. And we actually did a brief study just even looking at going into northern Canada as opposed to driving versus delivering the remote assessment, and it was a 10-fold difference in overall costs. So a very simple cost for an assessment all of a sudden goes up by 10 times, which can make it prohibitive for many clients. The other part that we also were interested in and why we wanted to look further at remote assessments is we also have to look at the safety of our own practitioners. And being on the roads, there is a high level of potential risk that an individual could have an accident. They are away from home. So we saw if we could actually reduce the travel time on some of these remote roads, that would improve the overall safety of our ergonomists and our practitioners. The other thing that's very interesting is a lot of people are now actually looking at telework, and they're working out of their home environments. And we saw it as a way to also reduce some of the liability associated with people going into home environments. So we saw it as an actual improvement in terms of overall safety and reduced liability for our own consultants. So I'm going to turn it over to Catherine Ritchie now, and she's going to go over some of the background onto how we actually looked at developing our protocol.
All right, thank you, Linda. So like Linda's mentioned, at EWI Works, we first decided to explore these remote ergonomic assessments because we wanted to improve our services to our rural clients and find an easier way to provide follow-up visits for them as well. So I'm just going to walk you through kind of what our process was. So prior to our case study, pilot studies had been completed out of Boston University, and they had looked at the sensitivity of assessing workstations remotely using static photos and computer workstation checklists. So the studies concluded that using the computer workstation checklist and these 17 predefined photos, an expert could successfully identify mismatches between an employee and the workstation. However, the authors did note that while it was a promising method to conduct the assessments, further research was recommended to explore facilitators and barriers to the service. So when it came time for us to look at our own methods and how we were going to conduct these remote assessments, we knew we wanted to have a quantitative score that could compare our findings between an in-person and a remote assessment. So when we started to look at different tools that were available, we came across the ROSA. So that is the Rapid Office Strain Assessment tool. Well, a couple of reasons why we like this. It was already a validated tool. It's based on visual inspections only. So we don't need to be there. We don't need to be tactile. We don't have to have any actual access to the workstation. And it already provided a framework in which the photos should be taken. So it already had a predefined set of photos that we could use for our own remote assessments. Another reason why we liked it is that we felt that it could be a useful tool to provide differences of risk before and after recommendations have been implemented in office ergonomics. So in case anyone has not seen this tool before, we just have an example of it up on the screen. So the ROSA tool gives a total risk score. What it also gives risk scores for is 3 different categories. It'll give a risk score for the chair, risk score for monitor and phone, as well as the mouse and the keyboard. These categories allow us to compare pre-assessment risk as well as post-assessment risk to provide metrics to our clients. So in order to complete a ROSA evaluation and to make it an ergonomic evaluation remotely, we required employees to complete some upfront tasks prior to the assessment. So any employees who were participating in our remote assessments were first required to complete an online questionnaire regarding their work tasks, their reported discomfort, as well as their work habits. Next, they were also required to take a series of photos as defined by the ergonomist, which we based off of those ROSA photos, and return the photos prior to the start of the assessment. Once the ergonomist received these photos, what we were able to do was complete the ROSA and give ourselves a pre-assessment score. This was also used to analyze the workstation and identify any mismatches between the employee and the workstation prior to the assessment. Just a quick mention about the photos that we did use. These sheets that are up here on the screen are an example of the worksheet that was sent out to employees with the definitions for the photos. So what we did is we modified the ROSA photo list a little bit by adding a few extra photos to the instructions. We provided detailed instructions for the camera holder. So what we found was really important was giving them specific instructions on where the camera point of view should be from, just to make sure that we were getting the proper body angles that we needed to see. We also included details of the area that should be included in the photo and any additional instructions that might have been needed. The additional photos that we added on top of the ROSA photos were photos of the chair. So the entire chair, chair control levers, and the entire workstation. And these were mostly just used to help the ergonomist guide the employee through and coach them through changes that might need to happen during the remote assessment. So once the upfront pre-assessment tasks were completed, we started to look at examining the photos. We identified those risks through the ROSA and made any notes that we might want to address during the remote assessment. The assessment itself was typically lasted about 60 minutes. It was done via video conference. So once we were actually scheduling the employee in for their remote assessment, we sent them a link to a GoToWebinar. Our assessment process typically consisted of an interview. So this is where we would gather information regarding discomfort, work tasks, any identified mismatches, or anything that we felt was missing through the photos. From there, we used screen sharing of the photos to demonstrate our identified risks. So if we felt that there was a mismatch between the workstation and the employee, we were able to demonstrate this by showing them the picture. Employees were then verbally coached on how to make workstation adjustments. So once we felt that we had defined a process that we felt comfortable and confident that we could identify the risks and provide recommendations, we approached an Edmonton-based nonprofit advocacy group to participate in a pilot project with us. So this pilot project was broken into 2 phases. Phase 1, we performed remote ergonomic assessments on Edmonton-based employees in the company's main office. After completion of the remote assessment, the ergonomist visited the employee in person to conduct an in-person follow-up visit to ensure risks had not been missed during the remote assessment. In Phase 2, we performed remote ergonomics assessments on home-based employees who were located Canada-wide. These employees received the remote assessment and remote follow-ups with no in-person visit. So just to walk you through a little bit of our delivery method, every remote assessment in Phase 1, what we did is every employee had to complete their pre-assessment preparation From there, that initial ROSA score was calculated. This was to give us a pre-change risk score. From there, the remote assessment was conducted, and a second ROSA score was completed. This ROSA score was to identify the risk that we felt was now present after making our on-site adjustments. From there, an in-person follow-up visit was scheduled. So the ergonomist went into the employee's office here in Edmonton to conduct a quick follow-up visit and to identify if any mismatches between the employee and the workstation had been missed, and a third ROSA score was conducted. From there, we just summarized all findings and recommendations in a report and returned that to the employee. So what we did with these ROSA scores, we compared ROSA scores 2 and 3, so the post-online assessment and the post-in-person assessment, to ensure that no risks were missed during the remote assessment. The first and final ROSA scores were also compared, so that was a pre-change and post-change metrics, just to show a decrease in risk with ergonomic change to provide metrics to the client. So what we found in our phase 1 was that after comparing the post-remote assessment and the post-in-person ROSA scores, nothing additional was seen that affected the ROSA scores. So therefore, risk was not changed, and we did not miss anything that would significantly impact risk. This was sufficient evidence for our stakeholder buy-in, and we proceeded on to phase 2 of the project. So again, just as a refresher for phase 2, we then started performing remote assessments for employees that were located Canada-wide and working from their home office, and we were no longer doing these in-person visits. And just a quick refresher here for the delivery method, what we did is they again went through their pre-assessment preparation. Pre-change ROSA was conducted as ROSA 1, and then the remote assessment was completed. If needed, this is where it was a little bit different, and we had to alternate our methods a little bit because we couldn't go on site to double check our adjustments. What we had employees do was complete new photos post-change, so we could double check that the changes that we coached them through during the remote assessment were in fact done correctly. And if a chair was being recommended, we had them complete a chair measurement worksheet. From there, a second ROSA, which represented the post-change risk, was generated, and we generated a report summarizing our findings and changes and recommendations. And that was it for the sale. I'm going to pass back to Linda.
Thank you, Catherine. So that gives you an idea of what we did in our case study, and we certainly learned a number of lessons that came out of the case study, and it helped to inform us as we started to go forward to deliver this out into with our regular clients. So the first lesson learned that I thought was actually quite important is that you're often trying to engage your key stakeholders and get them to even buy into the idea of a remote assessment. And often we'll talk about the cost benefit, and there's lots of reasons that we can help support why we may actually do a remote assessment from a cost perspective. But we ought to get over some of the perceptions people held around a remote assessment versus an in-person assessment. And some of the perceptions are that a remote assessment may not have as much value as an in-person assessment. So what we were able to find from our from moving forward, that where we had a good relationship built with a company already, where they saw and we could demonstrate the quality of our assessments, they were often a little bit more willing to actually test out a remote assessment. So having that previous experience actually helped us to move forward with some of the remote assessments in more of the rural communities. The other thing that we found as well is that it was really important that we had a good debriefing after the first initial remote assessment with a company. So if we had a remote assessment delivered, we needed to then follow up with the employees and also follow up with the key stakeholders to actually see if they felt there was value in the assessment itself as a frontline employee, and also if people could actually make decisions based on the findings that we had put together in the final report. So I found from our first lesson learned, really key stakeholder buy-in is often a staged approach, and it takes time for people to feel comfortable. And we actually have one client now that as an engineering company, and they've gotten quite comfortable with it, that any assessments outside of the city of Edmonton actually are all done remotely. So sometimes it will take time in order to get that key stakeholder buy-in. The other thing that we found is really important is taking the time to actually develop employee rapport. So the initial contact is really important, that people understand how the remote assessment will actually be delivered, what are the expectations in terms of the process. If they have any hesitations, they can actually reach out and talk to the assessor beforehand, just so that they get their level of comfort. And we actually found if there's an opportunity to send a picture of the evaluator ahead of time and even set up a phone call, just to kind of get that rapport started, it really helped to support the assessment itself. So taking that time up front became very important, that people felt comfortable with the process. They would understand what would be taking place during the pre-work as well as the actual assessment, and then the final report as well. So just taking that time for building rapport. Another big lesson learned for us is understanding technology. And one of the big things for us when we first started is we realized that we needed to have a camera. We'd probably need to have an integrated camera into the computer, or a camera that could be used along with the computer itself. But it's really important, if you're going to be using software where you're going to be trying to do an online assessment where it might be a sharing system, it's important that you understand the security concerns that might be associated with that company. So you make sure that you're not going to have any barriers to actually using the software for video conferencing. And I also found that it's really important that you take the time to understand what's the best bandwidth that goes with that software as well, because having poor bandwidth can really affect the quality of the assessment, and it affects the confidence of both the employee, but also affects the confidence of the evaluator if they feel that they're continually trying to overcome the technology concerns. So it's really important that people have a good understanding of what the technology requirements are. And there may be some times where the technology may not be supported, so that has to be a decision within that process. The other thing that was quite interesting is the point of view. And most of the cameras are built so you're front facing, and we often need the angles that are from the side. We might need an angle of a chair. And things that can affect it is certainly how we can position the camera, but also an overall lighting of the environment. If the environment's too dark, it's often hard to see how people are adjusting things. One of the ways that we actually overcame that, because that was a problem in some of the cases, is we actually had people send a second set of photos to us. So after we'd done the assessment, to just make sure that they'd actually implemented correctly, they would be asked to send a second set of photos. So that helped us make sure that they had actually truly applied the recommendations correctly. The other thing that we were quite surprised with as well is the hidden time requirements. So yes, there is certainly cost benefit from the perspective of travel costs, but it actually adds some hidden costs in terms of time for us as evaluators. So in the original case study, we actually had people fill out an online SurveyMonkey questionnaire. They also had to provide a series of photos and some measurements. So it became a little bit of a challenge to actually manage all that information, and we would sometimes get things coming in at different times. So we had to make sure that we were keeping the file management correct and making sure that everything had been covered off prior to the assessment. The other thing that was interesting is that we had to have time to also look at the photos prior to doing the assessment. So that added some upfront time so that we could start to prompt some of the questions that we would have at the face-to-face in terms of the video conferencing. In most cases, the length of the assessment took at least 60 minutes. So because of the coaching nature, it's not as easy to just get in there and try to adjust things. We have to be able to talk it through, provide even images that we can put up on the screen to demonstrate, but it's just a different way of actually coaching a person through those changes. In many cases, because it was a remote assessment, if the organization did not have local vendors, we had to seek out local vendors to make sure that if we had equipment that would be recommended, that we could source it. So there were some additional time requirements around that as well. And the final thing that did delay sometimes report writing specifically is if we didn't get specific information returned to us. So a second set of photos or even some of the chair dimensions that we needed. So we're very much dependent on the client. The other final challenge, and this is where I see a huge opportunity actually for telehealth assessments, is in the office environment. In many cases, in the office environment or the home environment, individuals may not have a second person to help take photos. So that makes it a little bit challenging. That's actually something we're trying to work through right now. The other thing within a home environment is that the furniture is often less standardized, and we've seen lots of variety of things that people are sitting on as well as working off of. And so having those measurements become even more critical so that we know what we can work with in terms of recommendations. And then again, with the home environment, most people want to be able to source things quite easy, and making sure that we again find local vendors. We're also looking at the fact that we want to make sure the costing of some of that equipment is not prohibitive, because in many environments, employers may not be supporting purchase of equipment in the home environment. So it really depends on the overall policies of the organization. The other thing that we also found really interesting was that there are some employees that do better with remote assessments and those that are better suited for in-person. If we have somebody that's open to technology, they tend to be a little bit more receptive around having a remote assessment. And there can be challenges around technology, so having the ability to be willing to problem solve is really helpful. And that independence, so if we provide some recommendations, that they're willing to try them and give us some feedback on that. So that's really important from an employee perspective or frontline perspective. The other thing that I found interesting as a manager with a number of ergonomists underneath me is that there's also ergonomists that are best suited to deliver telehealth assessments. And if a person is very kinesthetic, they like to touch things and adjust things in terms of chairs or even placements of monitors, it's a different set of skills than actually being able to provide coaching. And a lot of it is very much communication through verbal coaching and also use of pictures. So it's a little bit different set of skills, and they need to be developed. Also, it's important that they feel comfortable with technology, because it's not atypical that something will freeze up or people have problems connecting. So being able to problem solve becomes very important with technology. And then a very big aspect for us is that the person has a significant amount of experience. And the experience comes from understanding different types of furniture, common problems that are seen with furniture, and even the ability to recognize different types of chairs or different types of keyboard systems. It just gives that person a leg up to feel more confident when they're actually doing the communication online. So all of this really, the communication skills, their technical expertise, and their experience really feed into the confidence of the ergonomist. And that comes across, and it's really important when they're delivering the telehealth assessment. So to date, we certainly still have challenges. If you'd ever talk to my staff, they get kind of sick of me always coming up with my new challenges. But I like to always look at how we can streamline and how we can keep developing. And certainly one of the things that we've worked on, and I'm going to talk a little bit about an app that we've developed, is how do you actually streamline data management so that we keep everything coming into one place. We don't have to worry that things are being incorrectly saved, but it's all coming in as one file. The other pieces around technology, how do we actually improve point of view? How do we provide more immediate feedback? And always keeping in mind that we have to be cost conscious. And you see on the image here of the presentation that we have a double robotics. It's actually a portable iPad on wheels. It's a really promising piece of equipment, and I quite like it, but it's not cost effective if we're starting to look at remote assessments. So often seeing what we can look at from a hardware perspective becomes really important, and that's really led us into where we're moving forward as we start to develop new strategies to deliver telehealth. So to date, we actually have a telehealth app and this is actually available for free on Android or the Apple Store. And if you search under EWI Works, you'll actually see two different apps come up. One's for office ergonomics to help employees do a simple self-adjustment tool. The second one is our remote ergonomics assessment app, and it's called Ergo Connect. And it actually has a whole series of instructions. It actually integrates a pre-assessment questionnaire, has photos, and it also allows people to schedule their time. So I've shown you a couple of screenshots here, and the first part is really about collecting information about the job, some demographic information about that individual, and also some discomfort survey information to help us better understand where they might be experiencing concerns. The next part of it actually has a whole series of almost shadow images that people will have a good visual of what we're trying to achieve when they take a picture. So it has a visual image that they can actually focus on. They try to actually line it up, and then they take their own picture. But it also has a written set of instructions. So we felt that's really was important in the app, that we integrate also a visual of what we're looking for, but also a good description of how to actually take that picture. The final part of the app actually allows the person to propose some times and dates for their assessments. And we found that back and forth of trying to establish a time for it and date for an assessment can really delay when a remote assessment gets done. So having them already propose times actually streamlines it as well. So I'm sure some of you are probably asking, well, it's great that it's in the public domain, but if we want to use it, how can we use it? Well, on the last picture of the slide, there's here, it's a from and a to. You can actually put your own email address in there or give it in the instructions when you're setting up a telehealth app, and that report will come to you. And the important thing for me to bring across, none of this information is stored on a server. It immediately is collapsed into an email, because that was very important for us, that we still protect people's information and it's not stored anywhere on a server. So in terms of bringing to the conclusion to this particular presentation, we feel that there is great opportunity for Tele-Ergonomics. We really believe that it's going to improve accessibility for people that may have difficulty accessing staff or qualified personnel. It's also, I feel it's going to allow for more follow-ups to be done, because even in big cities, we're looking at time that's associated to travel. There's often parking costs that are associated with it, and people might veer away from doing the follow-ups because of those added costs. So I see there's more of an opportunity there as well. And I see it as us also making that leap into some of the paper-based things that we used to do into more use of technology. And I know a lot of the clients that we work with are looking that we're keeping up in ergonomics with technology advances as well. So I'm just going to end it there. Thank you very much for allowing us to speak today, and I'm going to turn it back over to Karen.
Thank you so much. That was so interesting. I learned quite a bit about telehealth. Now, I don't see any questions yet. So I'm going to, oh, wait. I do see a question. Let me see if I can get Sue's question. Let's see what she said. And Sue, thanks for joining us. Sue is one of our regulars, so we're thrilled that you're here. Let's see. Sue, I'm going to try to read your question. How do you, she wrote, how do you engage line manager to get their buy-in? Did you have any objections to people having to take photos? And let me stop with that, because there's a few more questions in that.
So that's a great question. So first of all, we actually make that a requirement of the telehealth assessment. We believe that's part of the buy-in by the frontline employee to actually take the photos, because the front-facing view with the video camera just doesn't give us enough perspective at the current time. And yeah, we had some people that they were delayed, they didn't take their photos in time. So certainly that is a challenge. So so I'm glad that's brought up. That can be a challenge.
So Sue asked a little bit more, some more questions in her posting. She wrote, would you think photos are as good as using videos, which is what we use for remote assessments? We also found that getting people to do a checklist as a first step and handing that in takes some of the responsibility to them and helps them to be informed rather than having it being done to them.
Yeah, they're both very good comments. Like I think video is very helpful, and we certainly feel it's critical as well. I think that's the next step, certainly, to make sure that if we're going to take video of people that are actually doing their work, that they're not certain perfectly straight up, that we're actually getting some of their behaviors as well, because I think that is very important, is be able to see some of the behaviors that they actually do as well. And I know that there are apps that do compress video, which helps a lot, because that was one of our concerns, is how do you actually communicate in terms of sending those visual images. So I think as we keep moving forward, yes, absolutely, we want to get video. The checklist is a great idea as well. Sometimes we've run into some of the concerns where people are really at a loss of where to even start. So I think it's, again, surveying the frontline user to see what they're willing to do. So great comments, though.
Could you, thank you very much for that response. Can you give our listeners a little bit more detail on how they can find your two apps in the App Store?
So if you go under EWI Works, it will bring up both apps. So just type in EWI Works, and then it will bring up the Ergo Office, and the other one is called Ergo Connect. So it's Remote Office Ergonomics.
Yeah, and they're easy to get. I have them on my smartphone already, and I've actually recommended them to some of my students in their projects, and they were extremely impressed with them. So this is a wonderful contribution that you've made to all of us in ergonomics.
And what we're hoping, Karen, and this I would reach out to Sue, who's posed that question, is that we really hope that we can continue collaboration, because we're a very small discipline. And I was laughing when one guy said, you know, we're really an extinct group. If you really think about it, we're on the extinct list because we're so few in number. And so wherever we can get the expertise out there and we can start enhancing service, that's going to be just that's better for our clients long term.
That's a really good point. Thank you. So we've got another question. Were the reports individual, or were they, you know, how detailed were they? Can you describe a little bit more about the reports?
So they were very detailed, actually, because we treated them as if we were doing an in-person assessment. And some of the coaching that would have been going on where, you know, we weren't able to physically be there to actually make the adjustments was added into the report. So yes, they were individual, and they had to include both the behavioral changes and the recommendations for equipment changes as well.
Great. And I do want to say, anybody who would like the link to the apps, if you're having any issues with it, please just post your email and I'll pass it along to Linda. And I'm sure she'll follow up with the link, so it'll be easy to find.
And just as a heads up as well, we also have it for Android as well. So it's for Apple and Android.
That's great. Thank you. So, you know, obviously this is a topic of great interest to me as well. Where do you think this is going in the future? Where is telehealth going? And I'm going to give just a little bit of a U.S. perspective on this, and maybe you could do a Canadian. Some of the issues we have in the United States as occupational therapists doing ergonomics is that our license is not portable. So if I want to see a client that resides in, say, California, I would need to have a license to practice OT in California. Again, our license is not portable, and with that in mind, I have 5 licenses in states in the United States, and it's a little cumbersome and pretty expensive. So that's one. The other is reimbursement. In this regard, maybe you could describe the reimbursement for the Tele-Ergonomics, and then perhaps, if possible, reimbursement in Canada in general for anything that's telehealth, telemedicine, telerehab.
Yeah, so we have the same issues about going across jurisdictions if you're a licensed healthcare professional. And so that's the same issue that you experience in the US, Karen, as well. So definitely you need to have licensing in the province or the territory you're going to be delivering the service in. That's not such an issue for a certified ergonomist because it's not governed by a Legal Professions Act in Canada. So that tends to be a little bit less of a concern for people that are not under a licensed profession. The other thing around reimbursement is typically it's done by the employer. So it's usually covered through their short-term disability plan, or they may actually cover it through their health and safety service. So right now for ergonomics, it's not going through any health plans per se. And so it's usually covered the same as an in-person assessment. And I've even had some employers, they're willing to pay the extra for the time that it takes to deliver the telehealth assessment. So they see that there is added time that's associated with it. And we have a cost differential between an in-person assessment and one that's remotely delivered. So I hope that helps a little bit.
Yeah, it does. And you know, the delivery of services via telehealth technology, I think is so important, and its growth is really on a global level. So let's imagine 5 years from now. What do you think you might be doing differently? You described lessons learned. You know, the technology is evolving. Who can even imagine what 5 years from now might look like? But what do you think you might be doing related to maybe tele-ergonomics, telehealth, that you're not doing now? You know, what might you do differently, do you think?
Well, I think that we're going to have more integration of giving real-time feedback to the client. Right now, the pictures, the video even potentially could be somewhat delayed. I think we're going to get more real-time feedback and be able to integrate it all into one hardware device, which I think is important because there's still right now there's separation between platforms of how we collect information, how we also deliver the actual real-time synchronous assessment. So I think that we're going to get to a point where it will be much more fluid and more real-time that we're going to be delivering. So I can see, like, we're already at the point of where we can do the education component. I think we're going to get much better in terms of being more synchronous in terms of assessment and feedback. And I think we'll be able to even help them with sourcing product even easier, because we might be able to use GPS in some way of even figuring out where they're at and what are the available options. I think we don't even know where we're at, or even sensors to give us feedback. So I'm pie in the sky, Karen.
No, that's why I asked you, because that's where we want to be.
Yeah.
You know, one thing that I use that I haven't done a study on, so I'm not necessarily recommending it because we have to really look and see if it works. But to address Sue's issue, I've actually used have somebody use a GoPro. That's the name of a company, obviously.
Yep.
Wearing that, and I've used it for home assessments. Mm-hmm. Because I want people to walk around. I want to see what they're seeing at their eye level. It was actually a home assessment that we did for a caregiver of someone who had who was taking care of someone who had dementia, and looking at some of the safety issues. That was really effective. And now I just did a live video stream for Facebook, and the person used their iPhone, doing the same thing, but having, you know, like something that they held onto, that clasped onto it and could rotate. A little bit more expensive than, you know, what I was describing, but to get the video was quite remarkable. So, you know, I think you're right with the technology. I heard also, you know, we've got technology now that's being built into clothing.
Yes.
You know, there's so much that it goes beyond our imagination at this point in time. But I think you did a great job with your, like you call, pie in the sky. I love that.
Well, I see it's exciting where we're going, and the more people that can be contributing, the more opportunity that we're going to see some really exciting things in ergonomics.
I totally agree with you. You know, I think the future is limitless in some ways with our imagination. Not even limited by our imagination. I don't think we can even think about what it might be. So one last question I want to ask. Are you planning to conduct any more studies?
Yes, we really feel that in order to move forward with any type of advancements, we've actually got an engineer now hired on staff, and we go through a whole testing protocol because it's really important for us to keep learning from the studies, and that's how we keep growing. So we felt it was critical for us to, as ergonomists, to get more skill level, but we also felt we needed an engineer to help support how we move forward as well.
That's fabulous. Want to give us a sneak preview of anything?
Well, yeah, we're doing some things in the industrial environment right now of how we can actually use more data collection in sites so that like there's so many things that are so manual still in the industrial environment when people are going through and they're categorizing risk. And we're looking at opportunities to how we can capture data and analyze it more effectively so that we can spend the time on solutions, because that's often the analysis eats up a lot of the time for solution generation.
Yes, absolutely. It sounds like this is going to be a wonderful collaboration.
Yeah, it's exciting.
So, Linda, we're going to conclude now. I want to thank you very much. And do you have any last thoughts you'd like to share with our listeners?
The only thoughts that I have is any types of things, and it was already brought up today, different ideas that people are already using. It would be exciting if we could ever get a group together and work to collaborate on lessons learned, things that people are trying to test out so that we can get more sites to even test it. And that's where I'd like to leave it today, is that we build a potential collaboration with people to keep it expanding and developing.
That's great. And you know, you could easily use technology to do that, you know,
Exactly.
social media and setting up maybe a blog even in that regard.
Yes.
If there's anything that we can do with the work journal, we'd be happy to do it as well.
Exactly. And I think that's where we're going to see great advancement, is when we have different sites pilot testing different types of technologies. We bring those lessons learned back, because we're considered a big organization, but for ergonomics, which is we're only 12, that's still very small in the grand scheme of things.
Well, I think you may consider yourself small, but you certainly are mighty. Thank you both so very much for this really interesting and also, you know, futuristic way of us looking at the delivery of services. And I hope that anyone who listens to this is inspired as well and reaches out to us. We hope you subscribe to our Learn at Work YouTube channel, where if you've missed any of the Learn at Work webinars, you can listen to them at your leisure. So Linda, again, thank you so very much. And we are concluding this webinar.
Thank you.